Hello! Welcome to Class 1 of the Flourish Health Externalizing Behaviors class. Thank you so much for taking time out of your busy schedule to watch this video and to do the follow-up work. This class series is designed for caregivers who have adolescents with externalizing disorders. That means behaviors that can be explosive. Sometimes your kids have been diagnosed with oppositional defiant disorder, conduct disorder, or DMDD. As we go through class today, I will use the terms the patient, the child, the adolescent, or your child interchangeably. The reason that I use the term patient is because we're a healthcare team. We provide really world-class treatment for your child and for you as your child's caregiver. And so we often refer to them as our patient. Some of you may have younger teens who still can be considered children. Some of you have adolescents, some of you have young adults. Because I don't know exactly the age of your child, I'll be using those terms interchangeably also. And I recognize that for many of you, you're not the biological parent of the child that we're talking about, and so I will say thank you for the role that you play in their life. And because you have been identified as their primary caregiver and you have a hugely impactful role in their life, I hope it's all right that I'll still refer to parenting skills and to this young person as your child. As a quick introduction, welcome to Flourish if you are new as a family in our program, and thank you for being in our program if you've been here for a while. My name is Natalia. I'm a Stanford-trained physician, and I have the honor of being co-founder and CEO. My job is to really help set up the team to do really great patient care for your child and for you. And I have been working very closely with our clinical leadership team to review a lot of research and a lot of expert input on how to support you in what can often be really complex lives that you're navigating as you're supporting your teen. So I have the honor of doing some of these class videos while our team reinforces the work with you. All right, so really quickly today, what we're going to review is an introduction to Flourish and to this manual, the class. Then we're going to review some key concepts related to teen mental health. And then we're going to do some quick homework, which I think will be really fun. First time anyone said that about homework, I'm sure. All right, so for our introduction section, let's review who your Flourish Health team is. At Flourish, you and your child will have a team of 4 professionals. The first is the family guide. This is your primary partner who's here to support you. The family guide is probably the team member that sent you this video, and they will be leading you through learning and applying the skills from this class series. And they're really also helping with external case management, so they will be supporting you with school advocacy and coordinating with your child's pediatrician as well. You may hear a lot about the patient guide, who's the person that's using guiding hours to build a relationship with your teen, do some in-home visits or in-person visits as needed. And internally at Flourish, this is the person that's really the quarterback for your child's care, making sure that we are understanding all of the things that they need and delivering on that. The therapist is doing individual therapy with your child using a different treatment manual that really allows the patient guide to reinforce what's being worked on in therapy in between sessions, and the therapist is also supporting the guide team with case management. The psychiatrist is a board-certified child and adolescent psychiatrist. They will be leading the way with diagnosis, medication management, and really supporting integrated treatment planning. We're really proud to provide you and your child top quality mental health care, and part of that is supporting you as their caregiver. Together, we're really committed to ensuring that you get the support that you need, and part of that is through this course. And I really want to emphasize as we go into this course some key concepts here. The biggest takeaway is that this is a safe space. We approach you with the respect and privacy that you are due as a part of our patient's family. Having a child with behavioral struggles can be highly stigmatized in many communities. And even if you're in a community where it's not stigmatized, we're very much going to respect your privacy. The only times that we have to break confidentiality is when there's a concern about your child being unsafe, or your child posing a threat or a danger to somebody else's life. It's really important to us to approach you and your child with respect and non-judgment. Everyone is doing their best. Our goal is to interact with you with understanding and respect, and really honor that you are the expert in your life and the expert on your child. We are here as trained consultants for you. And then participation. You may have different comfort levels with discussing concepts with your family guide. That's okay. The more you discuss and work with them, I think the easier it will be to learn these skills and apply them, and to see the behavior changes you want in your child sooner than later. The goal for this class is to help you make significant changes in the home environment so that you can feel confident you have a safe home environment, that you have a positive relationship that's positive for both you and your child, that your child experiences clear rules at home, and that you are able to approach them with authoritative, positive parenting, which the research shows is the parenting style that results in really healthy, well-adjusted young adults. And we will cover that in a future class coming soon. All right, so here we go. All right, so how does this intervention work? Well, there's been a lot of research on what to do for children and young adults who have oppositional defiant disorder, or DMDD, or conduct disorder. And as we provide them therapy and psychiatry and patient guiding, those are really important evidence-based interventions. And actually, the most effective intervention is helping the parent or caregiver respond to the child differently. And why is that? That's because when we help you change how you respond to your child's behavior, your child begins to change how they behave. And then they start to learn that from their perspective, they can have their needs met without an explosive outburst. And what happens when both of those things happen is that your child starts to proactively use healthier coping skills to have more positive interactions. From the caregiver's perspective, you will start to feel like you have more control in the home and more of an ability to navigate your child's emotions without them having these really disruptive outbursts. And I think something that's really important to recognize as we begin this work is that we all want success to be a straight line and to be really clear and predictable. And really often success looks like a wiggly line, where when we step back and look at the big picture, we see the general direction of improvement, but there may be moments, especially if a stressful event happens where your child regresses and starts to use their previous behaviors. That doesn't mean that the work you're doing isn't working. It may very well be working. What it means is something happened in your child's life that they haven't yet built up the skills for, and we just have to keep working on building up those skills for them and for you to support them in that. And so, again, behavior change, it will require consistency and commitment, as does everything related to parenting, which I'm sure that you are more than familiar with. So as a program overview, the goal of this course is to provide you with skills, techniques, and education to improve the dynamics at home. That is going to significantly improve your child's ability to interact with you, other people in the home, people at school, and other people for the rest of their lives. This is really foundational and can be a huge change for your child. What we will do each week is there will be a weekly focus, there will be an educational video, maybe featuring me, on that weekly focus. And then the homework will be for you to work with your family guide to set some really clear goals and how you practice and apply those skills. You can practice the skills and role play with your family guide and then apply them at home with your child, and then discuss with your family guide how that went and what you learned and what you want to do similarly or differently, and then you guys can make a revised plan. And so again, we will need you to commit an hour each week to this course. that can be at whatever time works for you. The reason we have these classes as recorded videos is that so we can honor that your schedule is challenging and what matters is what works for you. So if you could make the commitment of watching the video whenever it works for you, and then taking the time to reflect on that, talking with your family guide about your goal for the week, and doing the homework. Our hope is that that's about an hour once a week, plus whatever time you spend implementing the skill with your child. And we'll revisit that at the end of this video when we talk about the homework for this week. And I just want to really emphasize that the changes you can make with this are going to be long-lasting for your child. And with any long-lasting change, it does take time. I hope that you're willing to try this and give it a little bit of patience and commitment. Okay, so a more tactical overview of this course, we will begin level 1 of the course is working on you having really advanced knowledge of what behaviors are, how to change behaviors for your child, and how to reflect on what are the specific triggers for you as a human being in the situation, and how you can meet your needs so that it's easier for you to recognize and meet your child's needs. And there's a couple of weeks in this level. And then level 2 is really about supporting you implementing skills in a really advanced way so that you can really see the changes that you want to be seeing at home and with your child. There's a couple of weeks here. And then level 3 is really supporting you and your child in working together to compromise and to negotiate. And part of the thinking there is that, your child is an adolescent. The job of an adolescent is to learn how to become an adult, how to navigate the world, how to advocate for themselves. And part of your role as their caregiver is helping them learn those skills. And so helping them learn how to, in appropriate ways, negotiate and compromise with you will be really foundational for how they learn how to negotiate and compromise with future family members, life partners, figures of authority, all kinds of things. This is also where we really help you feel confident that you can navigate and manage your child's behaviors even after your family graduates from the Flourish program. There's a couple of weeks here, and we can stay in this level for as long as you feel you need so that you can feel really confident. And the last level is maintaining skills, so preparing you to maintain the skills that you have learned and implemented throughout this course. As we know, many of our patients have more severe behaviors, and so we have sort of like a side exit turbulence level for if some severe behaviors happen, we can divert into here, and then once things stabilize a little bit, divert back to the progression. Who will be leading you through this? Your family guide will lead you through setting goals and using skills. And while you and the family guide are working on that, the patient guide is going to be working with your adolescent to help them buy into some of the changes that you're making at home. And the therapist will be working with your adolescent to help them process their emotions. So really, the idea here is that we are wrapping around you and your child with a warm safety blanket of interventions all at the same time. Okay. So let's get started with some key mental health concepts. Move my little face bubble around. Okay, so on the topic of mental health in youth, what is mental health? Well, mental health refers to the way that we think and behave. Everyone has mental health just like everyone has physical health. And just like everyone's physical health falls on a spectrum of healthy to unhealthy, everyone's mental health can also fall on a spectrum of healthy to unhealthy. And one of the things I really like about this analogy is that we all know that with our physical health, we can catch the flu and be down for a few days and then bounce back. Or, we could get pneumonia, need antibiotics, get treatment, and bounce back. And the same can be said for our mental health. We can have episodes where our mental health is less healthy for a couple of days, and then we're able to recover. And we can also have episodes where our mental health is less healthy and really needs a robust intervention in order to recover. So when do we know what is healthy and not healthy for mental health? when the ways that we think, feel, and behave start to interfere with our ability to function. And so when it is normal, for example, for a child to feel really sad if they didn't do well on an exam, it's not healthy if the child can't get out of bed for a week because they didn't do well on an exam. That's when their functioning, their ability to get out of bed, their ability to go to school has been impacted. They really need an intervention. Most likely, you and your child's previous mental health team felt that your child's functioning was being impacted, and that is part of how they got referred to Flourish. So our patients at Flourish have mental health disorders that typically fall into 4 categories. There's emotional disorders like anxiety and depression, trauma disorders, there's behavioral disorders, which likely your child has if you're doing this course, and we'll talk more specifically about that. And then there's psychosis-related disorders. Now, it is not uncommon for a child or an adolescent to have all 3 of these top disorders, because often the stress that impacts the brain can have multiple different impacts and effects. And that's okay. Our integrated intervention can address all 3 of these and really support your child in getting their mental health to a healthier, higher functioning place. Okay, so revisiting what is functional impairments. So really quickly, emotions are normal. It is part of being alive. It is part of the human experience to be happy, sad, angry, delighted, loving, frustrated, and experiencing the good and the bad of the world. Now, what is normal is for our emotions to come and go, and for us to have a wide range of them. What gets tricky or unhealthy is when the emotions that are meant to be temporary, when they stick. So when we feel really sad or really angry and we're unable to process that and let it wash through us and then leave, then it really sticks. And we start to then have that anger or sadness permeate all aspects of our life. And so again, that's when we start to have functional impairment. For teenagers, we often measure functioning by, are they able to go to school? Are they able to interact with their peers? Are they able to interact at home? And so when one of those functions is impacted, that is functional impairment, and we definitely need to provide treatment. As caregivers, your role in your child's mental health is absolutely critical. I can't understate this enough. Sometimes teenagers don't like to show how much they care or how impacted they are by their parent figures, but they really are so impacted, and they really are noticing how you treat them and how you approach them. And research has shown over and over and over again that strong, supportive relationship between children or teenagers and their caregivers can significantly help reduce the burden of their mental health issues. And if you're having some tensions at home, I just want to reassure you that's very common, and this course is going to help you address that so you can get your home environment to a place where it's a positive experience for you and for your teenager. Okay, so let's talk about what behavioral disorders are. So externalizing behaviors are when children or adolescents act out. This can be yelling, hitting, throwing, etc. And externalizing behavior disorders are when children or adolescents have these outbursts often enough to meet criteria of certain diagnoses. And almost always that means they have significant functional impairment. These outbursts are having an impact on them at school, their relationships with their peers, and their relationships at home. Sometimes the functional impairment is even more severe. It's not just about school and relationships, but it might be legal trouble with the police or getting suspended from school. And so at Flourish, we typically have 3 different diagnoses that adolescents might have when they have a behavioral disorder. And so the first one over here is ODD. That stands for Oppositional Defiant Disorder. And really the defining feature of ODD is that children may have this ongoing defiance. So children with ODD often refuse to follow directions. They might argue a lot, especially with adults or people in charge. And children might act out by doing things like deliberately annoying others, not listening, or refusing to follow the rules. That can be so frustrating for caregivers, for teachers, for people in positions of authority who are just trying to work with the teen to get some things done. And as frustrating as that is, I also want to pause and take a moment to put ourselves in a young person's shoes who's experiencing this. It's possible that they have had really challenging life experiences that they were not equipped to handle, and that the way that they handled it got them criticism or negative feedback, and that happened over and over again to the point where that child started to think, this is who I am, I'm a challenging kid, I don't let anyone tell me what to do, I push back, and this is how I protect myself, and this is also how I get any kind of interaction or attention. And that's thinking that we are going to change. We're going to change those patterns of thinking and behavior by interacting with them differently. And we're going to work on that over the next couple of classes. The other thing that I will say about kids with ODD is that research shows that almost all of them, sometimes 80% of kids with ODD also have ADHD, attention deficit hyperactivity disorder. Why is that so interrelated? Well, if you have ADHD and it either hasn't been caught or hasn't been treated effectively enough, what has your experience been? Your experience is, since you were little, since you started school, teachers would tell your class to do something, everybody else could do it, but you couldn't. You couldn't pay attention, you couldn't stay in your seat, and then you get in trouble. And you get really frustrated because why can everyone else do this but not me? And I'm always getting in trouble. I must be a bad kid. And I'm frustrated because I'm trying, but it's not working. And why can't I do this when everybody else can? And then that level of frustration bubbles up into an outburst. And that happens over and over again, and suddenly these two things are really correlated. They're being asked to do something that they don't have the attention for or the ability to stay physically calm enough for, and then they have this bubble of frustration that outbursts. So our team will be doing a lot to assess your child for ADHD, because if we can treat their ADHD, we can help lower their frustration a little bit to make even more progress treating their oppositional defiant disorder. Okay, now conduct disorder over here. So the defining feature of conduct disorder is this persistent pattern of violating the human rights of others or animal rights or societal norms. And so children and adolescents with conduct disorder, they often display very aggressive behavior or deceitfulness, theft, serious rule violations. And these behaviors can lead to significant impairment in societal, academic, and family functioning. For us, we try to intervene as early as we can to provide you and your child wraparound support, and we're also going to make really clear that we need to have strong safety planning. If you don't feel safe in your home, if you feel that other children in the home are not safe, or if you feel that this child with conduct disorder is not safe, we need to address safety first before we can really address the foundational behavior changes that can allow your adolescent to change their behaviors and no longer have such problematic behaviors. And so we will, in the next course, we will talk about safety, but what I will say for today is if you do not feel safe, if you feel your child is not safe, if you feel other kids in the home are not safe, you may need to call 911, and I really hope that you can reach out to our family guide and discuss additional safety planning measures. Okay. All right, so then the third diagnosis is DMDD. It's a bit of alphabet soup. This stands for Disruptive Mood Dysregulation Disorder. And so what is going on there? So technically, DMDD also has a component of mood, it's in the name, where the persistent feeling is this baseline irritability that children with DMDD often feel upset or irritable a lot of the time, and they might have angry outbursts that really seem out of proportion to what's happening in the situation or to their age. So kids with DMDD might have a hard time calming down, they might get frustrated or angry, and it can feel like their emotions are out of control. And so again, this course is really leveraging the evidence-based treatment to support this, and we anticipate being able to help you see positive results if we are able to commit and consistently apply some of these skills. The last thing I'll say about all of these diagnoses and conduct disorder in particular is that we know there's research in the field that sometimes there is a bias in how kids are being diagnosed. Sometimes kids are not given the benefit of the doubt, or they're given a diagnosis and it sticks even after their behavior changes. And a lot of the kids in our program at Flourish have, had really unfair life experiences. And so our team is really committed to assessing for ourselves. Our psychiatrist, our therapist, our family guide, and our patient guide will all work really closely together to assess what diagnoses are still appropriate and met for your child. And regardless of what diagnoses they have, you are welcome to do this course and learn some advanced caregiver skills and work with your family guide. Okay, and so just revisiting again, the goal of this class is to empower you to make some changes, to have a safe, positive home environment, a positive relationship that you are really proud of for yourself and for your adolescent, to establish clear rules at home, and to provide you with the toolkit should you choose to use authoritative, positive parenting skills. All right, homework. Again, this is going to require some consistency, some work, and some application, so let's have some fun with our homework. The homework for this week is 2 parts. Part 1, please think about what your top concerns are about your child's behaviors. And please prepare to discuss these with your family guide. The more specific you are, the more specific your family guide can be in helping you develop really clear, actionable goals for what we're going to address over the next few weeks in this class, so we can really address what your concerns are. Number 2, and this one starts today, please every day notice one positive thing that your child does. Name it to them. Just tell them, I love the outfit you chose to wear today. Thank you for putting away your glass. I appreciate when you tell me what you're thinking. Thank you for doing this, even though I know you didn't want to. It's so nice when you spend time with me. And if you're struggling to find something positive, that's okay. That's also very common. Try and find something then that's neutral, that's not a negative behavior. Thank you. I'm so glad that you stayed in school all day today. I'm really glad that you could be engaged in your education. Or, I'm really proud of you for putting your shoes away. Or, I'm really proud of you for not getting upset when your little sibling said something that's usually annoying. Or it could be as simple as, I'm really glad that you sat down for dinner tonight. It's nice to see you. So try that today. Find one positive thing that your child is doing and name it to them. And then keep a record. It could be in your journal. It could be on your phone. You could message your family guide every day. They'll message you back during family guiding hours, but they will love to see your daily message about what one positive thing your child did and how you gave them praise about it. And if you imagine for a moment, if you are feeling frustration towards your child, they're probably feeling that too. And again, as much as teenagers don't show it, they really want to feel liked and loved. And if you can find something that is genuinely something that you appreciate that they did and you praise them for it, oh my goodness, that will hit them so close to their heart and it will mean a lot to them. And over time, it might really help you build a foundation of positive exchanges with them for when you do later need to implement boundaries and consequences. It will also likely be a positive experience for you to see and remember that there are at least some moments of positive behavior from your child. So please, every day, one positive thing your child does and give them praise. And then think about, on the negative side, what are the concerns you have for your child? And your family guide will discuss these all with you. Family guiding hours are Tuesdays and Thursdays from 5 to 7 p.m. Thank you so much for watching this. I know that this was half an hour of your time and you're extremely busy. We're really excited to work with you on this and see the positive changes that we can help you make. All right, thanks. Bye.